Get started. Thank you all so much for joining us today. For those of you who don't know, I'm Brooke Waters. I'm the program manager for Leadership Gwinnett, and Lisa and Logan are on this call as well. So you can give them a little wave or send them a note in the chat box if you'd like. But I'd like to thank all of you for taking the time to join our discussion today about this important topic. We're excited to see so many faces today. This is a really cool, fun way to get to connect with everybody that we miss so much. So before we get started, I want to take a minute to just go through a few basics. First, I think we've already muted all of your microphones. If not, I am going to go through and do that just to cut down on the background noise and any feedback that we might get. If you have questions, try to type them in the chat box. I've seen a few of you kind of messaging back and forth in there. So it looks like most of you know how to use that, but that'll just help us not have everybody trying to talk at one time. But we will give you the opportunity to speak up. So when we see your question come through, I will try to monitor that and present those questions to Audrey. And from there, we'll call on each of you if you'd like to expand on that or ask any additional questions. Just remember, when you do speak up, unmute your microphone. You can either do that by pressing the unmute button in the bottom left corner, or I learned yesterday, I think on most computers, you can hold down the space bar as you're speaking. So I also want to tell y'all briefly how we got to this point. As y'all know, we like to do behind the scenes tours and social events. We typically do that maybe once a month just to keep everybody connected. And with all of this going on, we realized that we were missing those opportunities. So we thought this would be a great way to really go through and feed y'all some of that important information that you need to get through this. So that is enough from me. I am recording. Logan might be taking some pictures, but I'm really excited to turn it over to the guru of all of this, Audrey Arona. Audrey might have delivered some of your babies, I don't know, but she is now the CEO and District Health Director of the GNR Public Health Department, which covers Gwinnett, Newton, and Rockdale counties. So Audrey, I'm going to turn it over to you.
Good morning, everyone. It's so nice to see everyone, especially Marion's little puppy. So keep that on your lap there. I enjoy seeing that. I'm going to get right into this because this is going to generate, I'm sure, a lot of questions, and I want to be sure to be able to get to everyone's questions. So let me start with the latest numbers. Globally, we have 952,171 cases. And so nearly 1 million, and the deaths are right now at 48,319 globally. For the United States, our caseload is now 216,722, and that's 5,136 deaths. For Georgia, we're at 4,748 cases and 154 deaths. And for our district, which my district in Georgia encompasses Gwinnett, Newton, and Rockdale. And so I can just give you for a district, we have 340 cases, but most of those are in Gwinnett. And Gwinnett's cases are over 250 cases already. And we have 7 deaths in Gwinnett County already. It's important for everyone to know that, initially when this happened, and it's hard to believe that a month ago, Georgia had its first 2 cases that were associated with travel from Italy. It's hard to believe that, we're where we are just a month later. And to put that in kind of perspective for all of you, on March 16, Gwinnett County had 7 cases. And so now we're way above well above 250 cases now. But, initially the health department will investigate the cases and try to isolate the cases and keep it from the community. But as these COVID-19 cases have increased, we now shift, to more broader measures that, because it's impossible to keep all the cases isolated now. And we've seen so much community spread that our mission now is more in the lines of community mitigation. So with community spread, it's no longer possible really to identify every single person who is infected. So widespread infection is expected in the weeks ahead. I believe we're in the acceleration phase, according to all the statistics and people who can use those models to look at this. I believe we're in acceleration phase, which means we have not peaked in our numbers yet to any degree. Our focus now is more of a mitigation approach, which impacts the population at large. And so the best measure, the best way to do that, the best strategy is social distancing, which you guys have probably been blue in the face hearing about. But what that does is it decreases spread of the virus, as well as it also uses resources to provide support for our healthcare system and our critical infrastructure. Remember that 85% or more of the people that are infected with this virus will have just, mild symptoms. And the people most at risk are those that are over 65 years old, even without medical problems, and people who are older than 65 with medical problems, and then of course those under that age with chronic medical conditions as well. And what's interesting about this virus that is not so true with others is that cardiac issues seem to be a real factor here, whereas, and we're thinking that maybe some of the medication that is used in heart disease is somehow affected with this virus. And so that's not to stop all of your heart medications by any stretch, because, that has consequences, but it's interesting. This is different. This is a different virus than we've seen before. This is my message to everyone if you don't get anything else today, and that is that I need everyone to consider yourself infected and consider yourself that you have the virus and that you could give it to your neighbor. Also, you have to consider that every single person you're next to has it too. And so if you think of it that way, then there'll be more isolation techniques. Everyone's just a little bit more careful. And as you know, the communities and counties and cities have pretty much gotten together to implement orders to stay at home or to shelter in place at home. And it's unfortunate that what's happened is that the local governments and local jurisdictions have had to have the heavy in terms of doing that, right? But if you look at this, and I understand from the governor's standpoint that not every county in Georgia has numbers, but it's spreading so rapidly that I think that led to his decision last night to have a stay in place for the state of Georgia. But the way I've looked at this is local implementation, it is state managed, and it's federally supported. So that's just kind of how I've tried to help everyone understand, the politics associated with this. And that's really important. But as you know, the governor issued this state now wide stay-at-home order, which we can talk about for sure. And the order itself is actually going to be out today. I haven't seen it yet. And in that order will be listed what is an essential business and what isn't, and who is affected and what kind of things is considered essential business for citizens. So we will have that. I want you guys to know what the health department is doing in reference to this virus. So the first thing is we do have specimen point of collection sites. And so we're not testing the general community in Gwinnett County or across the state, primarily because we're limited with the number of test kits that we have. And every day I get probably 8 to 10 emails from companies saying, I have so many of these test kits, I can generate this, I can do this. And what happens is we have to be very careful with what we use as a test, because we do not want false positives, we do not want false negatives. And so all of those test kits have to be FDA approved and have to be conducted in a lab, which will give us accurate numbers, because the last thing we want is inaccurate numbers. So the specimen collection sites that we're doing, we have one that's situated behind the health department at the district office off of Riverside Parkway, and we've not advertised that location for obvious reasons, but it's not for the general public. What we've been doing for the last 3 weeks is we're testing only sick individuals and those people who are healthcare workers or first responders. We're also testing 65 and older patients with symptoms. We're also testing people with chronic medical illness or chronic medical problems that are ill. And it's a drive-through situation that we have set up. So we've done well over 600 tests in the last 3 weeks. We're also testing people who live in a congregate setting because that's where our outbreaks are happening. And I'll talk about outbreaks in just a minute. But so those are who we're testing right now. The governor and everyone is really pushing for more widespread testing. And there's two challenges with that. One is the test kits. And then the second one is that right now it's taken a minimum of 5 to 7, sometimes 9 days to get those test results back. And so it's hard to really, if you have a positive and you call them 7 days later, well, their symptoms are already gone. And if they were positive for COVID-19, their isolation is 7 days or 3 days without symptoms, whichever is longer. So it's like by the time you get their test result back, it's hard to contact trace who they've all been around if it takes that long. So the good thing about Georgia is that we have wonderful universities in our state. And so Georgia Tech, UGA system, even PCOM, Gwinnett Tech, all of these colleges are working with us. I think Georgia Tech is manufacturing the actual test kits. Georgia State is making the medium that is necessary for that virus to be transported into the labs. And then we also are utilizing their labs and all that's being set up right now on a contract basis so that we can expand testing in Georgia. So I feel like we're better than most states because we have that option and all that's being developed now. So how long will it be before we're able to do that? You know, your guess is as good as mine, but we're hoping, we keep hearing that it'll be in the, near future, next week, week after, hopefully. So once that happens, the health department has to have a plan for mass testing, right? And I'm kind of questioning as a doctor how that's really going to help us other than just to know the numbers, which I know everyone wants to know. It will help us in determining the death rate of this virus because right now we're testing only sick individuals and those people who are important to know their status. So, and there's guidelines that's been set way, what do you do for a healthcare facility? What do you do for an EMS, a fire station? What do you do in a nursing home or a jail setting? And what we're finding is that those people that are most at risk, if we can test them early before they seek hospital care and they know their status, then when they go to the emergency rooms, they'll know their status, which will be overwhelmingly helpful to the healthcare systems because right now, if you don't know if you have COVID-19, you have to remain in an isolation room and all the nurses and doctors wear personal protective equipment because they don't know. So obviously testing those people who are ill early in the stage before they become seriously ill, it'd be beneficial if they know what their status is, obviously. So we're trying to test those where it makes the most sense. Obviously, if a healthcare worker is ill, we need to know if they have COVID-19. The general rule for most healthcare facilities is that 24 hours after all your symptoms are gone and you don't have a fever any longer, then you would be allowed to go back to work. And that, of course, is, without the use of medications to lower your fever, okay? But with this virus, we don't really understand how long a person is transmissible with this virus, even after symptoms are gone. So if you're COVID-19, the recommendation now is that you stay at home and isolated for 7 days or 3 days without symptoms, whichever one is longer. The average in young people, it takes about 2 to 3 days of illness typically, but for some people, it's longer than that. And so that's why the 7 days is out there. So for those who are exposed to somebody who we think has COVID-19 or is confirmed to have COVID-19, the recommendation is to self-quarantine themselves from everyone for 14 days. And the reason for the 14 days is because the incubation period, meaning how long do you have, how long, if you're exposed to somebody, how long will it take to see symptoms, is anywhere from 2 to 14 days, average most likely 5 days. Okay, so we're looking at that. That's the reason for the 14 days. And what these people do then is once you're exposed to somebody, you'll be sent home for self-quarantine for 14 days. And what you do is just monitor your symptoms. So if your symptoms develop, then you become a case, and then you have to follow the 7 days or the 3 days without symptoms, whichever is longer. Hopefully that all makes sense to you, but if I need to kind of go over that again, let me know. But
Hey, Audrey, real quick regarding testing, Douglas Johnson asked, why does it take so long for test results to come in?
Right, and the reason is because the Georgia Public Health Lab can't possibly run all these tests, right? And so that's where we started for the very beginning. And all of those tests had to initially be confirmed by the CDC. So if it was positive there, we had to wait for a confirmed positive with the CDC. So now that's no longer in place. So we can get test results back quicker using the public health lab, but they only have a certain capacity to run a certain amount per day, which is not near what the state is collecting. So all of these commercial labs like LabCorp and Quest and a few others, if they're FDA approved, but those are the two major ones. They developed this commercial test that the FDA approved, and CDC does not have to confirm those positives, right? But they were unprepared for everyone in the country. If you think about it, every hospital, every health department, every medical office that's doing this, every long-term care facility, wherever they're testing, is all flooding these tests to LabCorp and Quest. And so their backlog is just out of control. Plus there's a medium, the medium that the test kits come in that, Georgia State is making, there's a worldwide shortage on that, right? And so that's why it's taking so long, is there's a backlog. The actual test to run it doesn't take very long. It's just that the lab facilities that are running these tests are so overwhelmed with specimens.
Okay, that makes sense. Thank you.
So that's what the health department is doing in terms of specimen collections. We're also planning for the expanded testing. So once these tests become available, hopefully this next week or the week after, the health department is now planning how are we going to mass test people. And so we're looking at, traffic flow diagrams and sheltered locations. We're actually looking at Infinite Energy Center parking lot because, as you know, if you've been, it's a pretty big place and you use that wraparound drive through and all. So we're looking at that for Gwinnett, and we have a place, actually a horse park in Newton and Rockdale where we can do it from there too. We're also anticipating, of course, remember there's no antivirals available now, and there's also no vaccine available right now, right? And so we're looking for closed pods. If you think about it, if everyone in Gwinnett County, 1 million people, need a vaccine, remember 12 Stone's giving out turkey, issue with the traffic and the traffic problem it created on 85. Can you imagine all millions of people coming to health department locations to get vaccines, right? So we've been planning for years to try to secure what's called a closed pod. That's where someone like, or someplace like Gwinnett, Northside Gwinnett, we would deliver vaccine or antivirals to that location, and then they would give out that vaccine or antiviral to every one of their employees and their families and the patients that are there. That's a closed pod. And so what we would do then is receive the vaccine or antiviral from the national stockpile, and then we would distribute it that way. So we would go to PCOM and we would give PCOM everything they need for their employees and their families. And we would go to churches and we would go to, all kinds of places. So we've been working on that for years. And so we're trying to organize all that now. We're recruiting medical providers, nurses, and volunteers because with the surge in our hospitals, which we'll talk about, we really are finding the absenteeism for the sick rate and everything else of these, the staff is crucial. That's a part of the hospital surging plans that we have to think about. So we've been working with them. We've also been managing essential public health community services that we do normally, like our WIC program, Women, Infants, and Children. I mean, they still need to get their vouchers for food and be able to collect food. So we're working on that, and then we're managing our own staff absenteeism, which has been a problem. We're also helping the hospitals, of course, with plans for surge capacity. So I'm thankful for our many, many partners, because the health department, I have only 300 employees, and there's no way that we could be doing this all on our own. So yeah, MRC, if you wanted to volunteer, or you have an organization where you have a lot of people that are off of work and want to do something, you can easily sign up for MRC, which is called the Medical Reserve Corps. And we rely on them a lot. You don't have to be a medical personnel. You can be, any occupation or any level of skill. And you just go to mrcgem.org and register as a volunteer. It looks really, really good on a college application, by the way, for your kids, to have that on there. But anyway, what we do is then we call MRC and we say, hey, we need 5 people to man a 911 call center for where we're doing our COVID-19 calls from 8 to 5, Monday through Friday this week. And then MRC will gather people and then fill those needs. So we've been grateful to be working with MRC in that regard. Viewpoint Health, of course, is our just amazing emotional support that they've given to the health department and the community, and also social services that they're helping with. Of course, our emergency medical associations and EMS personnel, thanks to Jeff Smith with all of his law enforcement people doing what you do. Matt Elder with Home First Gwinnett has been instrumental in helping us with a plan of what to do with a COVID-19 positive person who's homeless and needs to be isolated. What are we going to do? So he's been instrumental with Jennifer Hibbard with Viewpoint Health to help us put plans in place for that sort of thing. Kevin Strickland's been awesome with our residency program because they've been added personnel and doctors and all that. Gary Stout with Kaiser, it's amazing connections there. School systems are providing food, universities are helping us, like I was saying earlier, and then some. Our Board of Commissioners have been active in terms of putting together plans for the cities and just being instrumental in all of this legislative action that's been going on. Our churches have been amazing. And I just want to stop for a second and shout a huge shout out to Leadership Gwinnett, because I was a classmate with Jeff and Gray, and from 2019, best class ever. But we, I don't know what I would do in my position right now had I not made all those connections from last year. It's just been amazingly a blessing for me. And so I know you guys all know that because you have experienced the same thing, but I'm just so grateful for Lisa and her team and what you guys do. So should I take a break and answer some questions before we move on?
Yeah, I think so. I have seen a few come in. So if anybody else wants to post some in the chat box, we can look at those too. But one of the first ones was from Chris, and it says, if your job requires you to deal with the public, should you wear a mask and gloves?
Okay, that's a great question. And right now, no. And the reason no is because we don't have the resources to even protect our healthcare workers at the front lines and our first responders. So people are making masks. People are, there's a lot of companies that are making them. And so hopefully the supply will be more available. That's first and foremost is a supply, but the better answer really, I don't believe, it's not CDC guidance for individuals in the community to wear masks. If you consider yourself positive and your neighbor positive, the measures that you can take are far better than the false sense of security with a mask. And people don't use masks correctly because they touch them and they take them off and they put them back on, and then they rub their eyes, and they're just contaminating themselves. So a mask, like any other medical resource, has to be used appropriately, and most people don't use it appropriately. And so I don't think it's very helpful in the general community, and neither does the CDC. And that's why the recommendation is really that the public doesn't need to. I know you and I, all of us, see people out in the public wearing them now. So, you know, I just don't think it's helpful in this case. Obviously, if you're taking care of someone with COVID-19, or say your husband has symptoms and hasn't been tested because the resources aren't available, he doesn't fall in that high risk category, but he's being isolated away from the family at home, then in a room or basement or upstairs, wherever, and you're going to take food to them, he's the one that should be wearing the mask, not you, right? So when you're exchanging, you know, food, supplies, and that kind of thing. So, so that's the current guidance. Hope that answers.
So a mask is helpful in people that have it. It keeps them from spreading it, but it's not as helpful, I guess, preventing people from getting it.
That's right.
Okay, perfect. And then what would you recommend for people who are out and about in the public? Obviously, we hear wash your hands, wash your hands. Is there anything else that we can do to keep from getting it?
Sure. Well, you know, obviously, wash your hands every time you're in contact with somebody. Just, you know, be aware that this virus can live on surfaces for up to 3 to 5 days. And one difference, and we'll talk about the differences with flu and COVID-19, but, you know, one difference is that this COVID-19 can linger in the air, we believe, for 3 hours, right? And so when you're out in the public, you social distance yourself, you know, keep 6 to 8 feet between them. If you go to the market, I'm trying to get the markets to put a grocery cart or put a box in tape separated, so that when you're waiting in line, you're not standing too close to people. Clean common surfaces, because, you know, the virus can live on common surfaces for 3 to 5 days. And then, of course, you know, cough in your sleeve or a tissue if you have it, throw away, immediately wash your hands. But it's extremely contagious. This virus is highly contagious, and every single one of us have an immune system that is naive to this, and that's a huge difference. And so, as we learn more about this virus, I think, and as the numbers flow in, we'll get a better rate of, you know, a sense of what the mortality rate is. But we know right now that it's 10 times more deadly than the flu is. So.
How about when we go shopping or get packages and things like that? Is it good to wipe everything down? Do you throw the bags out? What's the best way to prevent keeping it on those types of surfaces?
Well, again, in cardboard is different. I think cardboard, it's only 24 hours, or paper, it's different. But I think I told my mom, who's 85, and, you know, I told her when she goes to the market, you know, to use, she kind of takes it to the extreme, but she'll use hand sanitizer a million times in the store, and of course the grocery carts, and some of the markets have really been great and proactive about this, and you have actually somebody out there wiping down the carts before you even take them, which is great. And that's to one extreme. To the other, there are places out there that don't even have hand sanitizer or wipes available when you first enter the stores, so it's kind of all over the place. But anyway, so yes, when you get packages, you know, just wash your hands after you open them, throw things away, you know, clean the surfaces. The biggest thing you want to do is just not touch your face all the time. Your hands are dirty. Our cell phones are so dirty, right? And so if you just keep things that you use often, just keep wiping things down. And if you do something with your hands, wash your hands. So that's how you can pretty much, you know, the recommendation is it can be anywhere. So you just want to protect yourself as much as possible.
Okay, and then Karen, you've had a few questions that you've been asking in the chat box. Do you want to unmute yourself and ask those? It has to do with public interactions as well. Or if not, I can just read those out loud. Oh, she said give her a minute. She's got to call in. So then I'll ask you a few questions that have come through regarding the testing. One is, are the tests that get results in minutes just as good as the tests that take 1 to 2 days?
Well, again, that depends on the type of test it is, okay? If the hospital tests are all FDA approved, CLIA licensed, all of that, and so the hospital is able to get test turnaround and much better. Usually medical providers are CLIA licensed and they're using moderate to severe complexity testing devices that are FDA approved and accurate, yes. There are a lot of scams out there where, you know, oh, you can send away for a $200 or $300 test. You can self-swab yourself and then send that back. Before you do something like that, make sure they're FDA approved and they have an EUA with the FDA. The other thing is that these labs are notifiable to the health department. And so if the lab source that you're using does not report to any physician or doesn't ask you for a physician, and they're just supplying the result to you, it's probably not going to be very accurate because this is a notifiable disease. And if it's positive, they have to take measures to contact public health. And so you're better off, you know, to go to someplace when we have more expanded testing to where you get that done and it's accurate.
That makes sense. And then a few people have also asked, how sick is sick enough to actually be tested with the limited number of tests that they have?
Right. Well, right now, if you're not in a high-risk category, you won't get a test. The people who are being tested are those that have to be admitted to the hospital, and they're going to be using isolation rooms and equipment. So even if you're, say you're a 44-year-old and they think you have COVID-19, but you're going to be admitted to the hospital, you will get tested. But if you're 44-year-old and have no underlying medical conditions and you're sick enough to be admitted, you won't get the test right now. And so, you know, keep in mind that all of our numbers about death rates and all that are skewed because we're only testing those who are severely ill and those who are in a high-risk situation. So when we look at our numbers, you can assume that this is more prevalent in our community than we're reporting, just because we're only testing those at high risk.
And obviously there aren't a lot of tests, but in the future, is there a plan to test asymptomatic people, I guess, if there is enough of those?
Yes, and that begs the question about, you know, you probably, if you listened to the governor's conference last night, there's a lot of question now, which is kind of a game changer for the governor. I think that's why he instituted this statewide stay-at-home policy in order, because there's been reports that 1 in 4, and I'm trying to confirm this because the commissioner said this last night, but there's been these reports of 1 in 4 people with COVID-19 don't show any symptoms, right? And I haven't been able to verify that number, but I have verified that there's 13% of kids with COVID-19 that don't have any symptoms at all. And I know that in our pediatric population, we really don't have a lot of kids that are affected by this virus, first of all, which is really wonderful. It's still less than 2% 19 and under who have COVID-19 that we know of. So that's good. But there's also 50% of skilled nursing facility residents who were infected where they had no symptoms at all, and they had no pre-symptoms. So, you know, you could, if you get the virus, if you're in contact with the virus and it takes 5 days for you to get sick, those, you know, the 1 to 5 days is your pre-symptomatic area, you know, that we're looking at too for that. And so we're concerned about congregate living situations, primarily because long-term health care places, nursing homes, assisted living places are filled with people at most risk for this type of problem, for this virus, of dying and having severe illness of this virus. And so one person in a congregate setting is considered an outbreak. And our state has over 67 outbreaks right now. In Gwinnett County, we have 8. More than that now, but 2 of those are in a jail setting, and the others are all long-term care facilities. And so we're also testing those also. So if we have one person sick in a nursing home, we're going to be testing generally asymptomatic people to try to get an idea of who has it and who needs to be isolated and all that. But so asymptomatic transmission is occurring. We just don't know. In the past, it was considered to be a lesser form of transmission. However, with more time that goes on, we realize that it's more and more a possibility. And so that's, I think, what initiated the governor's order yesterday. Did I answer that question?
I think so. And speaking of those congregate settings, Karen, I think you're with us now. Do you want to ask your questions regarding public transit?
Yes, thank you. So we're still running full local service. We're carrying about 60% what we normally would. And we've done some preventative measures to protect the driver. We've blocked off the front seat, but there's still a lot of people riding. And I'm starting to have this philosophical question in terms of public health. A lot of the people are riding, they have no other option. But at what point, with us continuing to run, is there a tipping point where we're doing more harm than good?
Well, speaking from the health director here, my recommendation is that you should not be carrying on those buses enough people where you can't properly social distance them from each other. So if your buses are full, I think that's violating, the governor's order and your local county orders. Gwinnett has orders in place for social distancing, and you're not supposed to have more than 10 people on. So at some point it becomes an organization decision, but you really should have less than 10 people on that bus, and they should be 6 to 8 feet apart.
And then I have a follow-up question with the operators. Kind of in the very beginning, I had a very proactive contractor running our service. So the second that, I think the first test confirmed positive in Georgia, she'd been handing out the operators the wipes, and they got gloves, but there's no PPE to be had. And if it has, it's been, going to the medical centers. Is there anything else we can do to help protect the operators, since they have such a high interaction with the public, more than maybe what we've done already?
Well, the other thing to consider is how close is the, by operators, you mean the drivers, right?
Yes.
So how close are the drivers to the patrons, right? I mean, maybe you could, on some of your buses, I think you have a mid-level door instead of the door right next to the driver. So maybe you could take that door away as an option to get on the bus and make everybody get on the bus in the mid-level. I don't know how.
Yeah, we've done that. We've done that with locals. We actually on Monday went to rear door only boarding and suspended fare collection. But on the commuters, there's only the door in front, and the paratransit, sometimes the drivers have to move a mobility device. There's just a lot. Some of it's just hard to social distance. Now, granted, most of the paratransit customers right now are dialysis, and everyone else is sort of self-selected on that group of population. But
yes, I get that, and they are at risk too, because the driver, if the driver is carrying, if the operators are carrying those patients, those patients are at risk from him or her as well, right? So, are they currently wearing a mask?
We can't get any.
Right. I think when we have masks, that they could wear them, and that would just be one more thing. Of course, you'd have to educate them on how to wear it. You just want to put it on and just don't touch it. You just don't touch the mask and you leave it on, and they don't need the N95s because it's, you know, just a surgical mask or any kind of mask would do. But that's one thing that you could do, but you'd have to make sure they're using it appropriately. I believe that transport is still, you know, an essential service listed by the commission, the board chair. So that's the only thing that you could do.
Yeah,
now.
yeah, we are. There's just other systems I've noticed, and it's like, this is where I started to get the philosophical part, because some of the other systems around the country, when they start shutting down, they're shutting down because they no longer have enough operators to run the service.
Right, right.
So
every business
I'm trying to, you know, how can we still support the community as much as we can, but try to keep everybody as safe as possible? And that's pretty much how my decision process has been every day since this has started. It's an adventure. So thank you, I appreciate it.
Yes, you're welcome. There's a lot of people who really think that, you know, we're making a big deal out of this. It's not as, you know, the numbers aren't that critical. And, you know, why are we making such a big deal? Why are we ruining our economy for this? And I think a big lesson was from the Spanish flu back in 1918. And if you look at what Philadelphia did, where once they had a significant amount of deaths, they waited 8 days to implement social distancing, and they had the highest number of deaths in the country. And St. Louis, on the other hand, implemented, before they really had many deaths at all, they implemented a social distancing, stay-at-home orders kind of thing. And their numbers were so low. It was amazing. But what they did that we learned is that they lifted those requirements too early, and then they had a second spike of high death rates. And so, you know, we learn a lot in public health by looking at things in the past. And so, you know, there was some lessons learned there for sure. We have at the health department been planning for an event like this forever. So we had purchased 39 portable ventilators that we have already distributed to all the hospitals in our district, and Gwinnett, being the biggest, got the most of those. And so we're fortunate in our county just because we've been kind of proactive about that, whereas other places haven't had the capacity to do that. I guess I'll wait to make sure we don't have any other questions before we go on with hospitals issues.
We have a lot of questions that have been coming in, and I don't think we're going to be able to get to all of them, but I think if it's okay with you, Audrey, maybe after this is over, we can kind of have a discussion and maybe answer those questions and then send out like a Q&A questionnaire to everybody that's on this call as well. Would that work?
Sure, absolutely. And so in the time remaining, do you want me to address what the difference is between the flu and COVID-19?
Yeah, if you want to talk about that briefly, that would be great.
Okay. First of all, they're very similar. They have the same similar symptoms, except we don't see as much of the body aches as we do with flu. But the biggest thing is that both of them can be fatal, of course. The spread is from person to person. A possible difference between COVID-19 is the spread through the airborne route that we talked about, because the flu is not generally like that. And neither one is treated by antibiotics, and both of them you treat the symptoms for. Remember, both can be prevented, and the major difference is that we have a vaccine for the flu. And there's a big misnomer out there, but the flu, if you get the flu vaccine, it does not prevent you from getting the flu. It will prevent you from dying from the flu. Okay, and people think, oh, I'm not going to get the flu vaccine because it doesn't matter, I always get the flu. Well, it's not meant for you to prevent from getting it necessarily, but you won't die from it because it mitigates the seriousness of how bad your symptoms are. So that's huge. But so if you haven't gotten your flu vaccine, please do it. What we have noticed with everybody washing their hands, we have had less flu cases, so yay. if there's any good thing about that.
Really quick, let me ask you, speaking of the flu vaccination, will there be any like antibody tests available for COVID-19 at some point? Is that on the horizon?
There certainly will be once we have enough, and that's the case. That's the question with, can you get COVID-19 again? Well, first of all, remember we all have not naive immune systems to COVID-19, so we can all get this, right? The question is do you sustain an immunity after that? And we don't know. I would expect that there's some level of immunity right after you've had COVID-19. But the question is, we just don't know if there's long-term immunity from this. And probably more importantly, this virus will mutate, okay? And it will change just like these viruses do. And so once we come up with a vaccine, you know, we'll have to stay on top of all that. But then it'll be, once a vaccine is available, then we'll all be better off, obviously. And there are antivirals that are being considered and in clinical trials right now to treat this. And I know some of the sickest patients are getting treated with this right now, but again, it's not available to general public for prophylaxis. We don't know the dose, we don't know how effective it is, we don't know side effect range, we don't know, you know, all that kind of stuff. But fortunately, those drug combinations that they're looking at right now are individually FDA approved, so they should be available quicker. But there's no vaccine at this time. So there are more flu deaths in the year so far than there have been from COVID-19, but COVID-19 is changing drastically, and you know, it's a new one, everybody's susceptible to it, and the mortality rate at present is thought to be higher than the strains of the flu vaccine out there for sure. So that's basically the difference. There are other differences with that too. I'm happy to answer your questions, but let me say also real quickly, talk about the hospital surge plannings. Okay, so all of our hospitals, we've been working with them on trying to plan for what happens when our cases exceed our capacity at the hospitals. And so Northside Gwinnett has a nice resource and teaching area right now where they can expand beds into that area. Eastside has an older hospital that they're looking at and will expand services to that. And also Northside Duluth is looking at Joan Glancy facility, which will expand also. We have several churches, we have several schools that have offered spaces for that type of thing, PCOM. We're using ventilators and converting ventilators from even CPAP machines and trying to exceed that. The state should be receiving more ventilators by GEMA, which is the Georgia Emergency Management Association, which is basically our manager of resources that come into our state, and then they get somewhere else. But I think if we just all remember that we have to protect those at most risk of dying from this, and that's why we do this. I know someone told me this morning that for those who want a world without vaccine, this is the world without one vaccine. So for people who are pushing the vaccine issue, this is a real critical time for that. I guess we should leave time for questions, Brooke, unless you have something else you want me to touch on quickly.
No, I think that's great. Do you know about how many cases our local hospitals are handling right now?
I don't know the capacity that they have right now. I know that they have had to use different wards and close off different wards for isolation purposes for their COVID-19 patients. I don't know. I think Gwinnett County is pretty okay with ventilator supply right now. There are places in Georgia that are really in a critical place about ventilators and are soon to have issues. And so as supplies come into our state, I know that they will be resourced according to need. But fortunately, you know, we just live in a state I couldn't be more grateful for, where the governor is very active with public health, and everyone is working together way down to the level of our own districts locally. And so we're blessed to live in a state where all that is happening. And it's not just just not public health. This is Board of Commissioners, this is city officials, this is county managers. Everyone is working together. And I just think that, you know, we need to understand how blessed we are to live in a place where that's happening.
Yeah, absolutely. Absolutely. Thank you. And thank you for all the work you've been doing on this. I'll ask a few questions that I saw come through earlier, and I'll just go ahead and ask you both of those at the same time. Besides washing hands, not touching faces, and acting like we don't have, or we do have the virus, what else can we do to help you or to help the health department?
Stay home. That's the biggest thing. Stay home. And, you know, all of us are at a level in our jobs and what we do. We have an incredibly great work ethic. I know we all do and we work when we're sick. We've always done that. Doctors have done that from day four, just because of the responsibilities that we have. I cannot emphasize enough that even if you're under the weather, just a little under the weather, stay home. That's the best way that you can help the health department, is just to stay home. If you don't need to go to work, if you can work from home, do that, because that's going to change. Right now, we're in the acceleration rate up, social distance and everything. If our peak is up high like this, it's going to drop that curve. It's going to level the curve or lower the curve. You've heard that term. And that's exactly what's going to happen, is that if we can keep this, think about this, and I've said this from day one, if everyone in the United States could just stay home for 2 weeks, all at the same time, right? The incubation is 14 days of this. Anyone who is home, you get sniffles, whatever, you fall into the 7 days, right? So if on the 13th day of staying home, you start to have a cough and a fever, you stay home and follow that 7-day rule with 3 days without symptoms, whichever is longer, right? This virus would go away. But the thing is if you think about it, you know, the city of Atlanta instituted the stay-at-home order, 3 weeks ago, right? So they have to still stay at home, because you can't do it in one area and then not in the other, because what you're doing is just letting this thing just pass around, right? So everyone needs to do this at the same time. And I'm asking, you know, the governor to try to limit travel out of, if you want to go out of the state, fine, but don't allow anybody back in, right? Just don't let anyone else back in. Let's contain it here. And I know that's hard for a lot of people, but that's my personal opinion. If we all did this at the same time, this would be over a lot sooner.
Mm-hmm. That absolutely makes sense. And we're coming up on 11 o'clock, but I'm going to ask one last question that's more future thinking. And that is, what would need to happen for you to recommend that it's safe to relax the stay-at-home orders?
Well, I won't be making that decision. We'll have to be making that as a state, just because of the numbers. I think we're always going to be behind the data in public health, because if there's several positives out there right now I don't know about, and so by the time I get the data, so there's a lag time there, but we'll know when that peak starts to level off and then starts to decline. But when it starts to level off, that's not the time to relax restrictions, because we've learned from St. Louis what can happen. So you basically stay on there until you start to see it decline, and then we'll be better off. That's not to stop us from doing, you know, hand washing and everything else, but we'll be starting from a different place.
Yeah, absolutely. And there are many more questions that have been coming through, so I'm sorry to anyone whose question we didn't get to. I will talk to Audrey offline and we'll try to get you answers to all of those questions. But for the sake of time, we will go ahead and close it out today. So thank you so much for joining us, Audrey. We know you're so busy, but you shared so much valuable information that we can continue sharing with our networks and, you know, just really pass all of that forward. So we thank you for that. And I'd also like to thank all of you, our graduates and alums who joined us on this call, and thank you for taking your time to do so. Like I said earlier, this call is recorded, so we will send you a link with that information. And we'll also send you these questions that you've been asking with the answers that go with those. So hopefully that'll be helpful. If you have any other questions that we didn't get to, that you didn't put in the chat box, please feel free to reach out to us and we'll make sure Audrey gets those as well, as long as she has the time to go through and answer all of those.
I will, and let me give everyone my cell phone number, and my staff always cringes when I say that, but I mean it. If you need to reach out to me, you guys are my alumni, and you can reach out, just text me instead of calling me, just because I can answer tests quicker, but it's 678-794-4189. And text me if you have any specific questions about you or your family or your staff or anything that you need for your organization. I really don't mind if you do that. And stay safe, everybody. Stay home if you can, and hopefully this will be over soon.
Yes, thank you so much. And everybody, please join us next week. We're going to do this same time right here on Zoom again. And we are going to talk a little about the economic impact that this is going to have on the community. So stay home, but we know that that hurts our wallets a little bit. So join us next week. We're going to have Nick Messino, the president and CEO of the Chamber, as well as Lisa Anders, the executive director of Explore Gwinnett, to address those issues. So thank you all again and have a great day.
Thanks, Brooke. Thank you, everybody.
Bye. Thank you.
Brooke, will you send me an invitation to next week's?
Yeah.
Because I would love to sit in on that.
Absolutely. I would be more than happy to do that. Yeah, so like I said, it'll be the same time next week. We'll do 10 o'clock and I will send you that Zoom link. So Logan will get an email out with all of that information, but we'll go ahead and get you registered for it.
Okay. Thank you.
So thank you. And do you mind if I send you an email with these questions?
Sure, that'd be fine. And
Okay,
then I'll answer them and send them back. Is that good?
Yes, that would be perfect. And we'll include those in an email we send out to everyone.
Okay.
Because there were a lot. I was trying hard to get to all of them, but they just kept coming through. So people are really interested.
I know. Anything specific